Hello and welcome to episode 46 of the Fertility Rewire podcast. It's March 2021 when I record this, and spring has sprung, I feel, here in the UK. You might be able to hear birds twittering behind, maybe in the background. But what I'm going to talk about in this episode is something called mittelschmerz, which you may have come across or you may not, and it refers to mid-cycle pain, or you may have refer to it yourself as ovulation pain. And I want to just dig into that a little bit deeper in this episode. I'm going to talk about the physical aspects, but I'm also going to invite you to consider some emotional aspects as well. As ever, if you've got any questions about the episode, then do get in touch. But I wanted to share with you some feedback that I had from a client last week, actually. It's somebody that I've been working with who has been experiencing mid-cycle pain, but also mid-cycle bleeding. And we'd made steps to, the pain had started to reduce, and she dropped me a line to say, I am pleased to report that I've not had any mid-cycle bleeding for the last 2 months. I believe the routines and the extra work that we've been doing have helped me in this area. And also, I've been in much better spirits this week, especially compared to last week. And I'm hoping to continue with the tiger taming practices and thrive during my 2-week wait. And she said she wanted to say thank you for this and your passion. So I love, obviously, hearing reports on changes in cycle. I think people tend to think that perhaps the change they're going to see is the getting pregnant, which is our ultimate aim, of course, but it's these changes along the cycle that are so incredibly key, and ovulation pain, or mittelschmerz, is one such aspect. So I hope you enjoy the episode. Get in touch with any questions or feedback, and take care. Hello and welcome to the Fertility Rewire podcast, a place for information and discussion around topics relevant to fertility. I'm your host, Kat Stevens. I'm a fertility coach and founder of the Fertility Rewire program. And I'm passionate about people being given sufficient information to enhance their own fertility awareness. I wanted to talk this week about something that I actually come across quite a lot when having discussions with clients about their cycle, and specifically regarding ovulation, and that's ovulation pain. Now, ovulation pain is varied, and I'll talk about that as we go through, but it is referred to, you may have heard in your Google searches or things that you've been looking at, as mittelschmerz, which is a fantastic word. It's German and it means middle pain. So it is a word that is used to represent pain around the middle of your cycle. Now, you will know I've talked about the holy grail of the 28-day cycle. And if you have a 28-day cycle, and big ifs on all of this, if you ovulate on day 14, then that would be in the middle of your cycle. Okay, it doesn't mean it has to be bang in the middle. If you have a 30-day cycle or you have a 26-day cycle, then it's not going to be exactly in the middle. Hopefully, it would be ovulation, not pain. It would be 12 to 14 days before your period. Okay, so it is not the middle. That's the first myth that we need to put aside, unless you have a 28-day cycle and you do definitely ovulate on day 14. Now, when people are searching on a search engine or other means for information around mittelschmerz or ovulation pain, you tend to find a variety of information. You may see that what it says is it's perfectly fine and perfectly normal, and that it's okay. And there are even some suggestions on some websites, and specifically we see this in forum discussion areas as well, that suggest that it's a good sign of fertility because it's telling you when you ovulate, and you know this. Two things here. if you are waiting for your mittelschmerz, your ovulation pain, to know that you've ovulated and then you try to conceive, chances are you will be too late. Remember, the egg lives for up to 24 hours. So if you wait, as with ovulation sticks, as with predictors, if you wait for ovulation itself to try to conceive, chances are you will be too late. So that's something important, because of course the sperm has to travel, it doesn't get there immediately. I've talked about this before. So it's not necessarily a good thing. It varies really what people experience. It could be anything from a very sort of mild, dull ache to cramping to severe pain or a stabbing pain or absolutely debilitating pain is what some clients that I have specifically with endometriosis have reported and experienced. So it may be brief and harmless. It may last for a few minutes. It may last for a few hours on the suspected day of ovulation. So why would you feel something? Because not everybody does. And from my personal experience, at risk of oversharing as usual, I have never experienced this until I was becoming very close to menopause. So in perimenopause, very close to menopause. And I've always kind of thought, and this isn't medically proven, I've always kind of thought that my body's just working really, really hard to get these eggs out later in my 50s. So that's kind of been my theory, because that's when I started to experience it. But also, in some aspects, you can look at if there's a very high estrogen level in the body due to fluctuating hormone changes, then this can lead to increased symptoms of the pain as well, for a variety of different reasons. When you're ovulating, the follicle swells. The follicles grow on your ovaries like small finger-like projections. They grow and the follicle swells, and the follicle ruptures to release an egg. Okay, so rupture is quite a significant word. That's what's happening. It ruptures to release the egg. After release, other things that are going on in the pelvic space are the fallopian tube contracts. And this is to support the egg's journey, kind of encourage it to get to the right place to meet the sperm. So when this happens, what also can come with the egg is there may be some additional body fluids. There may be some blood, or there may be some fluid from around the ovary, and this may be at higher levels in different people. That then may enter the abdominal cavity and the pelvis and could cause irritation. So that could be an aspect to think of. And then we start to think, well, why would there be additional fluid? Is there inflammation? What can we do to support that pelvic space and the body in that respect? So as I've said, the feeling can range from a dull ache, a cramp, sharp pains, or debilitating pains. Now, there are other reasons for you to have pain mid-cycle. Okay, but first of all, when we look at ovulation pain, it is a sign that there may be something we can do to improve the pelvic space. It can give me a lot of indications when I take a full history from people. And then there is work that I do with my clients, and this has proved to reduce the amount of pain, and also in many clients to reduce any mid-cycle spotting that they might be occurring. Now, other reasons for these pain, that's why it's really, really important that you do seek medical advice if you are having more than just a very dull few minute experience. cysts can be an issue. Now, it's quite common that you can get follicular cysts. So after it has ruptured, it may swell a little bit more, but you may have cysts, and ovarian cysts can be just maybe one or a few more, or you might have many. So if you have polycystic ovaries or polycystic ovary syndrome, then there may be more pain mid-cycle. But again, let's not accept this as normal for you, that there may be something that you can do. Sort of additional signs that you can get with cysts, and you don't have to have all of them, by the way, but there can be pain. You can often experience breast tenderness, which will give us that indication of a hormonal imbalance. Maybe a sense of fullness in the abdomen. There can be pain during sex. It can be painful to pass bowel movements, and some women even experience nausea around their cycle. And this can be heightened around that mid-cycle, obviously, because the ovary is so active at that point. Another group of clients of mine that experience really significant pain around mid-cycle, and we can't separate it and say, oh, that's ovulation pain. Yes, it is pain associated with ovulation, but due to the endometriosis, it is worse, and it is a sign of the endometriosis. There is a lot that we can do physically to support endometriosis. That there is, I see some incredible results with clients that I'm working with to support this. In fact, this month, one of my clients who came to me not for fertility, she's not trying to get pregnant, she's had her children, but she has severe endometriosis, so severe that she's taking tramadol sometimes. Now, she has debilitating mid-cycle pain, and this last cycle, we've been working together for a month, just through some self-care advice, actually, nothing more than that. She's had no mid-cycle pain, and she's just let me know that she has had a pain-free period for the first time in her life since starting her periods. So that's incredible, and I really feel that's important to share, because there is a lot we can do to support the reproductive system, to support the pelvic area hugely in terms of endometriosis, and start to reduce those symptoms. One of those symptoms being ovulation pain. Now, with endometriosis, you can have effects on bowel as well, either constipation or diarrhea. A lot of people with endometriosis will report having IBS often before their diagnosis of endometriosis. So these are quite common symptoms to have the bowels affected, to have fatigue, to have excessive bleeding, painful periods. Again, there may be pain during sex when having a bowel movement, and there can be nausea related as well. So this is really key. The scarring and adhesions as a result of endometriosis can have an effect on the ovary. I have a client, or had a few clients with similar in the past with regard to fibroids. And when you think about the pelvic space, and I refer you back to a podcast episode, I'll put the link in the show notes, that I did with Claire Mockridge, and we talked about the pelvic space and how that pelvic space is small. And when you think about what is positioned in there, if the bowel is quite full from constipation, if there is scarring and adhesions, then things can be pushed out of the way. And if the ovary hasn't got enough space, you may have had an ultrasound scan and you've been told that your ovary is hiding. So if that's the case, then this can all affect the ability of the ovary to function normally and may include some pain. Also, pain mid-cycle or mid-cycle spotting could be an indication of a bacterial infection. So that's really, really important to get checked. And also, of course, ectopic pregnancy is that one-sided pain, potentially, pelvic inflammatory disease. And also, appendicitis, constipation, kidney stones, urinary infections, it can be more enhanced around this mid-cycle time based on what I've been seeing with a lot of people that I'm working with. So I invite you to, if you haven't listened to the episode Tuning into Ovulation, maybe have a listen to that and start to get an understanding of what's going on in your body around the time leading up to and during ovulation, and start to notice what you're feeling. Is it just a dull sensation or an awareness that something is happening? If it's more than that, is it purely ovulation pain? Of course, I'm not saying it's not ovulation pain or mittelschmerz, but why is it more intense? What's going on in the body? We need to consider the physical support needed. And I've mentioned a couple of clients. Well, I talked about one client there, didn't I? But it's a common theme I've seen where we've been able to reduce. In fact, it's one of the first signs when I start working with clients that people notice is they don't have the mid-cycle pain. And I say pain, not having the mid-cycle pain, and also many clients experiencing mid-cycle bleeding, and they notice that the mid-cycle bleeding has stopped as well. Think about the emotional aspects, because we know that stress affects fertility, fertility affects stress, and the hormone imbalance and things that are in place there may well affect your physical experiences that you're having there. Pelvic congestion is a huge issue, and it's about creating space in that pelvis. We're all sitting so much more. And within the last year, I'm recording this in March 2021. So within the last year, people are sitting a lot more. If you're working from home and you already have a sedentary job, then you're not moving around as much as you were. You're not walking to your place of work, or walking to the car and to the car park and then to the place of work. You tend to find that people are much more sedentary. Not everybody, of course, but many people are much more sedentary at the moment. Think about that pelvic congestion. Think about making space physically and emotionally in the pelvic area. Ways that we can support ovulation, we can strengthen ovulation to reduce inflammation. Okay, tune in to what's going on in your body. Notice, when are you experiencing this feeling or discomfort? Are you ovulating? What's telling you you're ovulating? What's the intuitive draw to ovulation? What are the signs of ovulation you're experiencing? Have you noticed cervical mucus? Is your sexual arousal higher? Now, I know that natural arousal around ovulation gets really dimmed down by the stress of trying to conceive. Your stress in itself, those tigers you're face to face with, are potentially affecting ovulation, of course, because why would you reproduce when you're surrounded by tigers? I say this time and time. So what are your physical signs around ovulation? What are your emotional signs, including your mood? Theoretically, in our mood, with hormonal balance, we would have more energy, we would be more positive, we would feel more creative. All of those aspects start to just, rather than, really trying to explain this, rather than overanalyze it, just have a feeling. What do you notice around your ovulation time? What signs is your body giving you rather than you searching for them, if that makes sense? There are ways that you can support the physical aspects and the emotional aspects around ovulation. There are ways that we can reduce ovulation pain. We can increase strength of ovulation. It's worth considering. So if you have mittelschmerz, maybe you didn't know it was called mittelschmerz before today, or maybe you did, but if you have mittelschmerz, let's look into that a little bit further, because it might actually be a huge clue in terms of what might be hindering your fertility. If you have any questions about this, want to know more about, I've supported the clients that I have referred to in this, increase your physical fertility and also reduce the emotional stress and strain you're experiencing during trying to conceive, then do let me know. But for now, take care. You've been listening to the Fertility Rewire podcast with me, Kat Stevens. If you wanted to find any further details, then you can check out the website, fertilityrewire.com, or find me on Instagram or Facebook or Pinterest at Fertility Rewire.